Welcome everybody. My name is Marcin. My father undergoes anti-cancer therapy in China, in one of the hospitals in Beijing. So the aim of this video is to tell you not only the medical story of my father, but I would like also include some emotional observations about cancer treatments here. My father is 61 years old and he was suffering from pain in the abdominal cavity from December 2011 or from Christmas 2011. We were trying to diagnose his problem in the hospital in Poland, in Krakow. And after 2 or 3 weeks, we made the whole range of all medical tests that were possible, CT scans, MRI scans, everything, ultrasound. And about the middle of January, the doctors were able to say clearly that my father has a tumor in the head of pancreas. And at that time, the diagnosis was already not so good because the size of the tumor was relatively big, about 4 times 5 centimeters. Soon after this diagnosis, just a couple of days later, my father got symptoms of mechanical jaundice. So we decided very quickly to save his life and to make a surgery treatment. The surgery treatment took place in one of the university hospitals in Poland. The treatment, the surgery went quite okay in the sense that there was no complication. However, the doctors stated that the tumor is not non-resectable, so it could not be removed. So the whole procedure had a palliative character. What was done was just the reconstruction of the intestine-stomach connection. They made a biopsy of the tumor and essentially that's it. So the diagnosis after the biopsy was that it was adenocarcinoma pancreatitis ductalis, so the king of cancers. My father was qualified immediately to undergo a standard chemotherapy in this case. However, during his recovery after the surgery treatment, the doctors detected a huge abscess above the liver. And they were trying to remove the abscess by means of laparoscopy treatment. However, it was not successful, so they just had to reopen the abdominal cavity again. And then they removed the abscess and cleaned the cavity completely. And at that time, our our problems started. The problem was that this secondary operation was required as long cut as the first one, and the wound after the operation didn't want to heal at all. This is partly because of the diabetes and also because of the cancer itself, right? So the situation in the end of January or in the beginning of February was that my father had 2 very serious surgery treatments and the whole wound which was not able to heal at all. So analyzing all the results, blood results and so on, the doctors decided that in that stage it is absolutely not possible to undergo any kind of chemotherapy because my father could not be discharged from the surgery department of that university hospital. After 3 weeks, the situation essentially did not go in the better direction. The wound was still not healing almost at all. My father had a serious inflammation, quite a high fever. They were trying to do their best, but the biggest problem was that the clock was ticking. We knew that we had no time and essentially no anti-cancer treatment could be applied. So that was the real problem. And as all of you know, this kind of cancer is a very aggressive one, probably the most aggressive cancers in the world, which is known nowadays. So knowing about this bad luck that happened to us, we asked the doctor what is the possible span of life that my father could live more. So they said that in this situation we think about 2 or 3 months, even if you take chemotherapy. So I just started to look for some other alternative options. And in the end of February, we were driving all together to Beijing, to China, to undergo anti-cancer therapy here. The trip was absolutely not easy because my father was traveling essentially with his abdominal shells, which were open. The wound was not healed. So we were very scared about the situation. He was very weak, but hopefully everything went all right. We were transported to the Army Hospital number 304 in Beijing, in Fucheng Road, and we were hospitalized there. Okay, this is the end of part 1 of this experience that I would like to share with you. The second part of my video is I would like to tell you why we chose this anti-cancer treatment, what factors were important at the time of making decision about the treatment, what are the advantages in my opinion, what are the disadvantages, and so on. So the idea is that I was trying to analyze very carefully all the possibilities. And then I found the web page of Cancer Therapy China in the internet, and I was trying to study the situation as carefully as possible. I discovered that the treatment that is offered here is top world scientific achievement that was done in the Cancer Medical Center of the University of Stanford in the US. I mean, this is ACTR therapy and DCCIK therapy. These therapies were elaborated in Stanford in the US by Professor Steinman and Professor Liu, who is collaborating very strongly with Cancer Therapy China. What was quite important to me is that in the year of 2011, Professor Steinman was awarded by a Nobel Prize in Medicine, and taking into account that the whole treatment was the result of the collaboration between Professor Steinman and Professor Liu, I thought that okay, it can't be anything stupid. This is something really top. I analyzed the scientific record about these therapies, and there are indeed very many good scientific articles written by Professor Liu, Professor Steinman, and co-workers in the top world leading medical journals. So that was my decision. I recommended this therapy to my family, and this is how we essentially decided to come here. My father undergoes 2 therapies in China. This is DCCIK therapy and ACTL therapy. ACTL therapy is this biotherapy which was granted a Nobel Prize, right? The Nobel Prize was granted to Professor Steinman, and Professor Liu was his collaborator and continues his research in this area. So, what is this ACTL therapy? What I like about this is that the therapy itself is not aggressive to the healthy cells. The therapy relies on using aggressive cytotoxic T lymphocytes, particularly the CD8 plus subset of these T lymphocytes to the patient. And the role of these T lymphocytes is that they kill only the cancer cells. These CTL lymphocytes are cultured in environment of the dendritic cells, which are previously transfected by a special adenovirus which recombines his genes with these dendritic cells. So the whole story is that the aggressive lymphocytes attack only particular cancer cells which produce a particular antigen. So this is what I like about this, that in the contrary to chemo or radiotherapy, there is no effect on the healthy cells. The patient's body is not destroyed or devastated. This CIK therapy is to some extent similar. However, in this therapy they use a different subset of T lymphocytes which are cultured in different conditions. Last week I was asking Dr. Calvin, who is the director of Cancer Therapy China, about some technical things, because myself being a scientist, however, I'm a physicist, I'm always trying to understand very deeply what is going on here. So he said that there is some result of some experiment about lung cancer, that, for example, if we take 100 cancer cells and prepare 100 CIK cells to attack these cells, so the ratio is 1:1, then these 100 CIK cells can kill about 10 lung cancer cells. And in the case of this top ACTL therapy, the situation is that about 100 lymphocytes produced by means of this technology is able to kill about 1,000 cancer cells. This is the case of the lung cancer, right? This is just the experimental result. So why I'm telling this? Because I was always wondering about, and maybe there are very many people who are wondering, is there any kind of magic pill that you can buy, come here to Beijing, swallow the pill, and voila, the cancer is over. So the situation is, this is not the case. There is no magic pill. If anybody is saying that this cancer therapy treatment in China is some kind of magic, I can only say that, hello guys, this is not a magic. This is a top scientific achievement which was done in the United States by American and Chinese scientists, and this is available in China. This is why we went here. We checked this, and we know what is the situation, right? So the situation is that essentially we have two contradictory processes. From one side, we have a process of constant growth of the cancer cells. And from the other side, we have active lymphocyte, which is a killer. This lymphocyte kills these cancer cells, right? And the winner is who acts faster or who acts more efficient, right? So if we know this, we can just think about the consequences. Why I'm telling you this? Because from our experience, I can only say that my father's case is a quite difficult case. We are suffering from pancreatic cancer. This is very aggressive cancer which grows rapidly. In the case of my father, the first CT scan which was done in the middle of January showed that the tumor has the size of something like 4 × 5 centimeters. In the end of January, it was something like 5 × 6 centimeters, and the local lymph nodes were slightly enlarged. We made another CT scan just after arrival here in Beijing, and the result was that the tumor size was about 10 × 6 centimeters. So you see that the growth rate is really fast. So what I want to say is that there are many groups of patients with different cancers. In our case, we are very respectful for the mother nature, because we know that we are very heavily experienced by this. What I want to say is that if we think about the definition of the word success or magic, in our case, I tried to be as modest as possible, and I would be already very happy if I could say that the result of this therapy is that we can prolong the life of my father as much as possible, and what is more important, I would be happy if we could improve his life quality. And actually this is the case, right? My father gets stronger, he's more vital, he plays jokes with the nurses, he laughs, things like this. And another CT scan that we made in April was that the cancer essentially stopped. So the size of the tumor is the same, and there's no further metastasis and things like this. So to some extent we already achieved our success. However, because personally I'm a so stubborn person, I was trying to analyze what might happen if we had other type of cancer or a different situation. So this what I know is that with this therapy we may expect different things regarding of the state of the patient, but because this ACTL therapy, which was elaborated by Professor Liu and Professor Steinman in Stanford, essentially assumed that it will be applied only to the patients with a serious healthy conditions. So there was a number of clinical trials, as far as I know, which were done in Stanford, and the treatment was applied there to patients with cancer in the stage 4. So people which are just about going to die sooner or later, or patients with advanced metastasis. And I checked the results, and there were several positive what I want to say, that the results of the therapies, that sometimes it's too late for the patient to expect recovery. Sometimes the lifespan can be significantly prolonged. I know the cases of patients that were suffering from a cancer in the stage 4. They were supposed to die in 1 or 2 months, and the result of the clinical trials was that these people were living 1 year longer, 2 years, 3 years, 4 years, 5 years, or even 10 years. I know that there are some cases that people were just cured completely, even from the stage 4. So I think that the therapy is really quite promising, and it could be applied to quite many people with quite positive results. However, from our experience, I just know that we always must have respect to the Mother Nature, because there are no magic pills, right? What I want to say about our treatment in the hospital, the treatment goes surprisingly smooth. What I want to say, of course there are problems, there are language barriers, but all the nurses that are working in our hospital are speaking some decent English. Some nurses can speak better English, some nurses worse English, but you can always find a communication with the nurse. A communication with our doctors is also very good, with Dr. Hao, with Professor Xiao. It goes quite smoothly. They speak English. And also we have our assistant Cindy. She helps us with any kind of common life problems. She comes every day to the patient. She helps with dealing with any kind of problems, with bureaucracy, with visa things, or just with food or anything like this. So this is my experience so far, and I think that we will be successful, taking into account what is the definition of the word success in our case. Okay, thank you very much for this presentation.